Duke here in lateral recumbency. Juan's just holding him in lateral. We're going to extrude that penis and then cleanse it before we put in a urinary catheter to collect a urine sample. First thing, we'll just go over all of our supplies here. So we've got a tray of diluted betadine, so that way we can cleanse the penis. And then we've got sodium chloride just to rinse after we cleanse it. So we'll do that a series of 3 times. So we've got some gauze to do that. We've got a 5 French red rubber catheter. We could always use a polypropylene rigid catheter as well, but these ones are a little bit easier to feed in these smaller guys. We've got a brand new tube of sterile lubricant, which Rachel will open for us when we need it. We've got a 12 cc syringe, our little vacutainer for our urine sample, a Sharpie to mark our container, a new 22 gauge needle, and then we've got a pack of sterile gloves. So first things first, we're going to have Juan extrude that penis from the sheath, and we'll take some of our 3x3s and just kind of soak them in a little bit of betadine. And we'll just cleanse the tip of that penis just to take away any bacteria, anything that's just right there on the surface before we actually introduce that catheter. And then we'll rinse with sodium chloride. Come back in with betadine. And I'm also just kind of trying to wipe away or push back the hair around that area. That way it's not in the way when we actually put that catheter in, because that again can be a source of bacteria. So just rinsing again with sodium chloride. And then last but not least, a little rinse again with betadine. And I'm just going to push back all of that hair. Okay, so what I'll do is I'm going to put on some sterile gloves. That way everything is kept really sterilely and we won't have to worry about any bacterial interference with the urine sample. Okay, Rich, will you just go ahead and open that urinary catheter sterilely for me? And I'll grab that from you. Perfect, thank you. Okay, now what you can do is if you'll just open that new tube of lubrication and just do a little dollop right in the center of that. So she's taking that seal off just because we want to make sure this is completely sterile. And so I'm just keeping the, yeah, go right ahead. So just a little dollop. Perfect. Perfect. And then what you'll want to do is just open that syringe sterilely and just drop it right in the center of that area as well. So while Rachel is doing that, I'm going to just measure the length from the tip of the penis all the way to the bladder, just to kind of estimate how far I need to feed the catheter in. So obviously the tip and the eye of the catheter itself. So we'll just kind of estimate without touching the hair, without touching the patient itself. And I'm just going to use my fingers as kind of a little guide. So right about there is where I want to feed it to be in the bladder. Maybe a little bit more, a little bit less. I'm just going to dip the eye of the catheter into the sterile lube, and then I'll go ahead and feed the tip of this catheter just very gently into the penis until my little mark here, which is just right at my fingertip, and just keeping my fingers right on the catheter itself. And that way I'm not touching any of the hair. And once I've got to that measured line, I'll take my sterile syringe, hook it to the catheter, and then I can pull back and I can get my sample. Ideally, because this isn't the most bacteria-free sample. We want to get as much urine as we can. Once we've got our sample, so I've got a full 12 cc's there, I'm just going to really gently pull this catheter out so I'm not causing any trauma to the penis itself. And I'm just keeping it hooked up to the syringe just to catch all that urine. So once I've got that, I'm just going to place my catheter. I'm going to discard the first 5 to 6 cc's just so that if there was any bacterial contamination, that's gone and away. If you'll open that 22 gauge needle for me sterilely, and then I'm going to stick the brand new 22 gauge needle onto this syringe. Thank you. And now I can just grab my Vacutainer, stick that in, let it suck all the urine in there, and now I have a completely sterile sample of urine. What we'll do is we'll label this with the patient's first and last name, the date, and we can run an in-house urinary sediment with this, get a USG, we can do a urinalysis in-house, but if we aren't going to be doing that within the next 30 minutes or so, we'll just go ahead and stick this in the fridge, or if we're going to be sending out to an outside reference lab, we'll stick it in the fridge, make sure that we don't leave it out at room temperature, because that can alter or cause crystals that weren't necessarily in the dog's bladder or in the urine to form in this. We'll just make sure that the patient is cleaned up and ready to go. We'll just get him hooked back up and back into his kennel, and we'll have him all set for the night.